Now we get onto our health segment, so do stay with us, and remember you can always ask any questions if you're just seeking clarifications or you just want to share with us your thoughts. We absolutely welcome you to do so. And right now, health. And today we're talking about contraceptives. Contraceptives have always been a subject of debate, and especially among the younger population. We will be getting to that in a bit, but today this is more of a learning platform. Contraceptives 101. So you feel weird about them, or you're not sure how to go about them, feel free to shoot them. We will be addressing them as we continue with the program. And to help me with this conversation in studio, we have Dr. Raj Dodia, who is a gynecologist at MPSHA. He's also the head of department at the obstetrics and gynecology department. Good morning. Thank you for being with us.
You're very welcome, Jain.
Always a pleasure to have you. And so today in class 101, so we expect feed from our guests, and of course you being here, you'll be helping us demystify this whole conversation around contraceptives. So we start with the basics as we build on it. Sure. And this, of course, starts with the definition of the term contraceptive in itself. When we talk about contraceptives, what do we mean? What category of medication is this? Right.
I'll start with the super basics.
Yes.
Right? And we talk about the human race as a whole. The human race actually lives its life with two things in mind. And these are the two things that our brain is actually made to follow.
Yes.
Right? One is survival and the other is reproduction. Okay? So reproduction is a very, very major part of our lives as we speak.
Yes.
And the human race is the only species that we know of that actually has sex for entertainment.
And
right?
not procreation.
And not just procreation.
Yes.
Right? And if we take that into account, we need to ensure that we need to be able to make it safe for the human race to have sex, to entertain themselves, but not necessarily leading to untoward consequences when they're not required, such as unwanted pregnancies. And therefore, that's where contraception sets in and steps in. Right? Contraception allows sexual intercourse to occur without the potential side effects of the intercourse, such as pregnancy.
All right. Now, at what age do you feel we need to start talking to our children about contraceptives? Because many a times you find it's a reactive conversation. You, as a parent, you think your child might be sexually active, or you actually get to know they are sexually active, and yet you've never had that conversation. So there and then, you find you have to react and talk about it. But when it comes to being proactive from a medical standing, at what age or at what point do you think we need to start having these conversations about contraceptives with our children, especially in the preteen and teen age?
It's very important that you mention the medical background here. So when our children are getting to the stage where puberty is hitting them, right? The change in hormones, there's change in the way they are thinking, they start looking at the opposite sex as a potential sex partner. That is a perfect time to recognize that this is what's happening with them, and we need to start this conversation as soon as you notice these changes have started with your children. Yeah.
All right, so it's very individual.
I think it's very individual, and we should keep it individual. We shouldn't have set time, set targets, set age, say the moment they're reaching 10 and a half or 12 and a half or 14 and a half, we should have this conversation. No. I recommend the moment puberty begins, the moment you start seeing changes in their body, their hormones have started changing, the hair growth patterns have started changing. You recognize that the hormones of puberty are now going to start off kicking these kinds of thoughts in your children. And that, I think, is a good time to have the conversation rather than stumble upon it.
All right. Yeah, because many a times you just find yourself having this conversation, and that is when maybe a problem has already occurred. Now, let's get straight to the forms of contraceptives that are there before we get to understand how you go about choosing it. Or maybe we should start by talking about what you need to pay attention to before you get to choose a contraceptive method. What are some of those aspects or considerations that as an individual you need to take into account before choosing any form of contraception?
Sure. So what I've done is we have actually come up with a questionnaire that we ask our potential patients to go through before they consider what may be important for them regarding contraception. And this is in conjunction with the University College London. What we've recognized is what is your age, what are your background medical conditions, when do you want your next pregnancy, right? Do you have problems with heavy bleeding? Do you have problems with painful menstruation? Do you have any issues with your sex drive or your moods? Would you consider having something that's going to help your skin? For example, there's certain contraceptive types that actually help clear up acne, right? So these are some of the important things that we talk about when offering contraceptives to patients.
All right, and I like the fact that you've mentioned, you know, looking at your medical background, because there are those who have pre-existing conditions and particularly issues to do with endometriosis, which is something that we talked about. And you find for some, it's either extreme bleeding, and not just limited to endo, you know, extreme bleeding or very little bleeding or no bleeding at all. Are there any consequences that come along if you take on some of the hormonal contraceptives that are available, and maybe looking at your regular cycle, it's near zero?
Yes, definitely. So any type of hormonally active contraception is chemically mediated.
Yes.
That means it's going to affect your hormonal cycle in one way or another. The issue with abnormal menstruation, whether it be heavy, whether it be painful, whether it be you know, not according to time, means that there is a possibility that there is some pathology inside the woman's body which is causing this abnormal menstruation.
Yes.
You need to get to the bottom of that abnormality first. You need to investigate to ensure there is nothing abnormal actually physically within that person before you can consider hormonally manipulating their cycle.
Okay, and I did get this question from our previous discussion. One was asking, they had history of endometriosis, but now they are at a point where they don't get their menses at all. Are there any consequences that could come as a result of not menstruating at all?
Yes, so there are certain medications that you take that will not bring about your menstruation, right? And I presume we will talk about them as we go through them. When it's hormonally mediated, medically mediated, it is safe not to have your menses, right? Primarily because your medical provider is aware of this. When it comes to naturally occurring no menstruation, then that is a potential recipe for problems down the line. Your body and your uterus is meant to menstruate every so often.
Yes.
Right? And when you don't do that, there is a possibility of abnormal growth inside your uterus, right? Which can eventually lead to cancer, for example.
Okay, so we need to get that checked if you are having concerns of no menses at all over a certain period of time. As the doc has said, naturally your body knows that if you're a woman, just to be specific, you're supposed to menstruate, but if not, just consult a medic, get the proper information and know how to handle that situation. Now, let's get to the types of contraceptives and birth control that are there, and I want us to start with the natural forms of contraceptives, because this is something that I, for one, have had my own reservations about. And let's just start with breastfeeding mothers. There is this conversation that when you are breastfeeding, it is a form of contraception, natural contraception. To what extent, if true, does breastfeeding contribute towards birth control?
Right. So that method is actually called the lactational amenorrhea method. Lactation means breastfeeding, amenorrhea means not having your menses, and of course method means method. When you are breastfeeding your child on demand, that means whenever the baby wants milk and you give it the milk, right? This can be very difficult, especially for first-time mothers.
Yes.
Right? But if you're doing this, then you are unlikely to get your menses, right? And this method can have up to 90% efficacy over 6 months, right? This is textbook. What we advise most of our patients is, let's not rely on that extra 10% chance that you may fail, right? Especially in today's day and age when we have a plethora of contraceptive devices which are essentially safe for you and your baby. The question is, would you want to take the risk?
So it is effective, but not, it's not foolproof.
It's not foolproof.
Okay.
Sorry, nothing is foolproof.
There we go. So in as much as you may be exclusively breastfeeding, you have higher chances of not getting pregnant, but there is the possibility.
There always is.
That is the clarification that we need you to get from this particular conversation. Now, getting back to still, are there any forms of, apart from, you know, just during this breastfeeding phase, natural contraceptives that from a medical standing, they hold ground?
Yes, yes, absolutely. So 2 of the more common ones include withdrawal, which means that the man ejaculates outside the woman's body. And the second one, essentially, is fertility awareness. That means the woman is aware when she has her ovulation and avoids sexual intercourse in the few days before and after the ovulation period, to avoid fertilization of the egg.
Do you support this narrative of safe days?
When a woman has a very regular period, ovulation occurs 14 days before she starts menstruating. When you have regular periods, you're likely to be able to understand when it is that you're going to ovulate. If you're having your ovulation every 28 days, every 28 days, every 28 days, you are highly likely to be able to pinpoint the day on which you're going to ovulate. And certain women have sensitized themselves to such an extent they can actually tell that they're ovulating that particular day, right? And when that is the case, fertility awareness can work. Absolutely. It can fail as well.
Yes. Now, I'd like to jump in on that part there where it can fail.
Yes.
And this goes to now the science behind it and looking at the lifespan of the gametes that are involved in this particular conversation. In as much as there are safe days,
yes.
Remember we're using quotes because it's not, it's not entirely safe. What do we need to know when it comes to the life cycle of both the male and female gametes, looking at that whole conversation around the safe days?
Right. So sperm inside the body can last up to 3 days, right? And we have records of up to 5 days, but majority of the times it's up to 3 days. The egg itself, that's produced by the ovary, usually lasts between 24 to 36 hours.
Okay.
Yeah.
All right. So with that information, do what you need to. All right. Now, let's move on to the hormonal forms of contraception that are there. And this is something that so many women, I see from my interaction, see going for. And we just want to understand, when you talk about hormonal contraceptives, what manipulation goes in this, looking at the female body and how they work?
Can we just step back a little bit?
Absolutely.
I just want to just to emphasize on a few numbers.
Yes.
Right? Without any contraception, if you're having sexual intercourse twice, thrice a week, on average, 85 out of 100 women are going to get pregnant within the year. Okay? If, for example, you're on the natural methods that we just discussed,
yes,
such as the fertility awareness or the withdrawal method, real life figures are giving us a failure rate of 1 in 4. So 25% chance that this method is going to fail for you on the long term, right? So 25 out of 100 women practicing these particular types of contraceptives are going to fail.
Yes.
Right. The other different methods of the contraception have actually lower rates of failure. And as we discuss, I will be telling you about them. So when it comes to the other methods, there are 2 types. There's the hormonal versus the non-hormonal. Okay?
Yes.
The non-hormonal include things like barriers, such as condoms, such as the diaphragm. The hormonal ones involve the implant, which is inserted and administered underneath the skin.
Yeah.
There is the injection, which is, as it's self-described, injection.
Yes.
There's pills. There's two different types of pills. There is also a coil that is inserted inside the uterus, which has hormone around it.
Okay. Now, let's talk about each at a time.
Sure.
For the benefit of our viewers. Again, as I said, this is class 101. So today you're going to understand what the pill is, how it is taken, what you need to expect, in terms of side effects. Every drug comes with its own fair share of side effects. So let's start with the oral pills that are taken on a daily basis. To what percentage do they provide protection against pregnancy, and why do they need to be taken on a daily basis?
So a clarification is that the daily pill are also of two types.
Okay.
Right? One type is it has just one hormone in it called progesterone.
Yes.
The second type has two hormones, estrogen and progesterone. Okay, I'll keep it simple. I'll try and keep it as simple as possible.
Please do. No medical jargon.
No medical jargon. So the pill that has only progesterone, this is a pill that you take every day at the same time. No breaks, nothing. You just continue, right? The combined pill, which has estrogen and progesterone, you usually take for 3 weeks in a row, or one pill every day at the same time, and then stop for 1 week.
Okay.
And it's that during that 1 week when you're going to have your menstrual cycle, when you're going to have your menses.
Yes. Okay.
Right.
Now, in the recent past, we have also seen an introduction of a new pill that women take at least once a month. It's called the Hubble Pill. And we just want to understand how safe it is, even because it is taken once a month, and I'm seeing so many women using it, saying it is very effective, taken once a month, and especially for those who tend to forget to take the daily pills, they do prefer this once a month pill, Hubble Pill. From a medical standing, in terms of even its safety, it being approved, are we even supposed to be using it?
It seems like you have a few ideas about this.
I have had quite the information about it.
Right. So what I can say, professionally speaking, is we do not know what's in those pills. And therefore, professionally, from a medical standpoint, I cannot tell you what the effects are going to be.
Okay.
What I do understand personally, and from my experience, is that it has a very high dose of a certain hormone.
Yeah.
But that's as far as my knowledge goes.
Okay.
Right? Because these pills are essentially distributed undercover, so to speak, right? We do not have access to more information about them.
All right. So as you use them, just remember it may not be as safe because the contents or its side effects are not as known by medics. Now, let's move on to some more of the hormonal-based contraceptions and talk about the injection, that 3-month injection that women get, in terms of its safety and its effectiveness towards preventing unexpected pregnancies.
The injection, you are likely to, if taking it as prescribed, right? But in the real life, about 3 in 100 women on the injection are going to have a pregnancy, right? So 3% failure rate, okay? In real life. It is rather effective.
In terms of percentage, at what point would you gauge it?
3%, so it's pretty good, I think.
97?
Yeah, 97% chance of you not having a pregnancy.
Okay.
So it's pretty fair enough, actually. There are a few reasons why people are moving away from injections, right? And majority of them, especially in our tradition and culture, has got to do with weight gain, right? And we've noticed that there's about a 2 to 3 kilo per year weight gain for patients who are using the injection quite regularly.
Okay.
Yeah.
I think that's a whole conversation for another day, just trying to understand this whole weight gain conversation, because I've seen so many women also refuse some of these hormonal forms because of the weight that is associated with some of them. Now, let's go to the e-pills.
Correct. Oh, wow. Favorite.
Yes. just roll with it as a medical professional.
Oh my. Okay, I'm going to let loose. Bearing in mind,
give a disclaimer when it comes to its usage.
Yes. Bearing in mind that we're on national television.
Yes.
So the e-pills are a recipe for disaster. I say this because some women like using it as their regular go-to contraceptive. I would like to discourage that heavily. These are the reasons why. Again, it has a sort of a medium to high dose of hormone in it. When you take it in one menstrual cycle, you are likely to upset your menstrual cycle because of the hormone content of the pill, which means that there is a failure rate, and that failure rate is usually higher than most of the contraceptive pills that we take. So when you take your e-pill, it's likely to fail more than if you take regular contraception. And if it does fail and you do get pregnant, you have a higher than normal chance of having what is known as an ectopic pregnancy, which can be fatal to you if not appropriately diagnosed. Yeah.
All right. We will leave that at that. In case you need any further clarifications about e-pill, send them through. Let's talk a bit about the contraceptive implant. The one that you had mentioned is put under the skin. First of all, why is it put under the skin in the upper arm? So
I think it's a fantastic piece of technology. It is actually manufactured to release a little bit of hormone every day, every time that it's in touch with your tissues, it's releasing a little bit of hormone, right? And it's ingenious, actually, I think. So different parts of your body get different amounts of blood flow, right? Your heart obviously contains the blood and is pumping it. Your blood vessels have it. Your muscles, less so, right? The rest of your tissues, even less so. So the amount of blood flow that's going through under your skin, just under your skin, also is limited to a certain extent. So this allows gradual but consistent release of the hormone into your bloodstream, right? To allow for appropriate coverage to prevent pregnancy.
So, but in controlled amounts?
In controlled amounts, yes. So it's very safe, very effective as well. We have usually the 3-year implants currently, and the failure rate is less than 1%.
Oh, wow.
Yes, reading 0.1 to 0.2%, right? So very effective when it comes to preventing pregnancy.
All right. And there was a question that came in from personal question that they're asking, in the event when somebody is on the hormonal implants and they don't experience the menses, is there cause for worry?
Not at all.
Not at all? Not at all. Because it is controlled and expected?
Correct.
All right, so there you have it. Now let's move on to the contraceptive ring. And this is some of different category, of course, but for the benefit of our viewer, and I'm told we are almost out of time, I just want us to look at some of this, and maybe you can tell us a bit about the contraceptive ring, because it's not very common among the people.
Right. Again, when used appropriately, you have about an 8% failure rate when it comes to the ring.
Okay.
So 92% efficacy when used properly, right? It is very effective. It is easy to use. It doesn't interrupt sex, right? It doesn't have many effects on your mood. It may, or your sex drive. It may. You insert it once a week. You change it every week. The week that you want your menstruation to occur, right? You don't, and that's your ring-free week, and you will have your menses at that time. Okay, and in terms of even helping our viewers understand what is a contraceptive ring, from a medical definition of it, what is it? So the same combined pill constituents, which involve estrogen and progesterone, are actually coated on top of the plastic or a rubber ring, right? And therefore, when you insert it inside the vagina, deep inside the vagina, around the cervix, it is actually slowly but consistency releasing those chemicals, those hormones into your bloodstream, right? Thereby preventing pregnancy. Okay. Now, speaking of chemicals, I came across something, the term spermicides. And this is foreign
from my standing, and maybe you could help us understand what is this category or form of contraception, if it is a form of contraception?
It does not really qualify to be contraception,
okay,
as far as I'm concerned, primarily because, yes, it does kill the sperm, because that's what spermicide means. So sperm is sperm, obviously, and side is to kill. Right?
Pesticide.
Correct. There we go. Well done. And therefore, it doesn't really count as a contraceptive in and of itself. It may be used in conjunction with other contraceptive methods to increase their efficacy, but it doesn't count as it on its own. For example, when you're using the diaphragm, what the diaphragm is it's like a piece of plastic, right, or rubber that you insert inside the vagina and put it up against the cervix, thereby blocking the cervix, blocking the entry of sperm into the cervix, right, because it's blocked.
Yes.
So this, to a certain extent, is effective, but when we use this together with spermicide, it's even more effective.
Okay. Spermicides, subject for a whole other conversation, but for the benefit of today, we just want to understand the different forms that are there. Then there is the diaphragm. Still not very common among most people that I've interacted with. So what is it, the diaphragm?
Essentially what I described right now. So it's a piece of rubber that is flexible. It's inserted inside the vagina to go against the cervix, right, and block the entry of sperm into the cervix.
So what's the difference between the diaphragm and the contraceptive ring?
The ring is actually just a ring. It's hollow.
But the diaphragm is more of a dome?
Correct. It's a piece of molded rubber, right, and it acts as a barrier for entry of sperm into the cervix.
Okay.
The ring is a hormonal contraception and therefore releases hormones in the area. So the mechanism of action is very different for both of them. Both are foreign objects that need to be inserted inside the vagina, right? The diaphragm does affect sex to a certain extent, in the sense that if you don't have your diaphragm on, right, you need to go and get it inserted and administered, right? After which you need to remove it, get it cleaned, etc. So it's a bit of a process. Is
it something you can do individually, or it needs to be done at a medical facility?
You do it yourself. So initially you need to be educated on how it works, what's the most effective way of it working, right? Timelines as well. For example, there's a certain time limit, meaning you need to ensure that it's within you, right? At least 2 hours before you instigate sexual intercourse, right? And after the episode, you need to ensure that you remove it appropriately within a time limit as well. You need to learn how to clean it. You need to learn how to use spermicide with it, if and when, right? So it's a completely different, it's a barrier method, not a hormonal method.
All right. Now, as we close the different segments of the types of contraceptives are there, and of course closing the program, there is the famous IUD.
Right.
For those who do not know what it is, maybe we could start with what it is and how it works.
Sure. So there are two types of IUD. IUD stands for intrauterine device.
Yes.
Right. The more common one is the copper intrauterine contraceptive device.
Yes.
Right. So it's a small T. It's shaped like a T with two threads that come out from the bottom of that T. Right. And it has wire, copper wire, that is actually wrapped around it. It is inserted inside the woman's uterus or womb, where it affects contraception, right? It does not allow sperm to go through all the way to the egg. If by chance fertilization does occur, if one naughty sperm manages to get away, and
there's always that one.
There's always that one, and manages to fertilize an egg.
Yes.
The fertilized egg, when it comes down back into the uterus to get implanted and grow, it faces a very negative environment, and therefore it cannot
attach
take.
Itself.
Correct.
Okay.
It cannot take.
Yes. Now, you had mentioned there are two types.
Yes.
There's the copper IUD.
Yes.
And
the other one is a hormone-based IUD.
Okay.
Right? So this is usually known as the Ius Intrauterine System. So it's the same thing. The concept is the same. It's usually a T of plastic with two threads from the bottom, right? But instead of the copper that is wound on top of the plastic, there's actually hormone around it. And this, again, consistently and efficaciously, distributes hormone within the area around the womb.
Okay.
In and around.
Now, due to the interest of time, we'll have to just pause this conversation right there. Next time, we'll pick it up just to understand the expected side effects when it comes to contraceptives, generally speaking, and those that are specific to different types of contraceptives, as well as, you know, trying to understand what works with you. This is a very individual conversation, so we will be getting to that point in a bit. But there is Alvin Karaoke on Twitter who's saying, good discussion. Would you kindly share the doctor's contacts? And maybe you could give us the social media handles also so that our viewers can interact with you post this discussion.
Sure. So my Twitter handle is Raj Dodia Gynecology.
All right, there you have it. You can follow him on social media. If you have any questions, you can always direct them to him. As and when he's able to respond, he will be getting to them in a bit. But for now, we just have to put a cap right there. This has been Health Tuesday, all about contraceptives. Again, as I always say, some of these discussions, we cannot fully exhaust them in one sitting. And that's why we always have part 2, part 3, part 4, as many parts as are needed to this conversation. But for now, we pause there. My name is Jain Wambui. On behalf of the Good Morning Kenya crew, we want to wish you a lovely day. Be sure to join us again tomorrow morning. We have been speaking with Dr. Raj Dodia, who is a gynecologist at MP Shah, as well as the head of department for the obstetrics and gynecology department. Thank you so much, sir. Always a pleasure.
Likewise.
All right. Have a lovely day. See y'all tomorrow.